It was confirmed by the Minister of Health, Dr. Frank Anthony, on Tuesday that several staff attached to the Georgetown Public Hospital had tested positive for COVID-19. At the time of that announcement, the minister gave the assurance that the situation was being managed and that medical services being offered by the institution were not impacted. Against this backdrop, the facility's medical director, Dr. Fawcett Jeffery, underscored during a press conference that things are under control at the institution.
And we have had the unfortunate situation where some of our staff, especially in 2 departments, were quite affected by the virus, but this did not create a loss of staff that would have necessitated a shutdown of the department, so we are still providing the service.
Based on numerical data disseminated by Dr. Jeffery, a total of 7 doctors and 56 nurses are presently affected. It was conveyed, however, that an outbreak at the institution is not surprising since it is the country's main referral hospital through which such hundreds of persons traverse the facility daily. To this end, it was noted that the institution has formulated a number of plans with the assistance of the Minister of Health to ensure that staff are safe.
And we've made decisions on the type of mask our staff will be wearing, the improvement in the screening process at the level of the gate, the visitation protocol.
According to him, there continues to be an issue with visitors adhering to the measures that are in place.
We have fights at the gate and difficulty at the gate because people think that they're being restricted from going to see their family members. But in COVID times, the protocol says we permit 1 family member to visit so that we can reduce numbers, we can socially distance.
This, he explained, is negatively affecting the well-being of his staff.
We end up with issues at the gate that sometimes even expose our staff more to cross-contamination, because when somebody gets heated and gets into an argument, they take off their mask so that their voice could be heard more and their virus is also spread more.
He reminded that the population has a role to play in ensuring that they adhere to the protocols that are in place at the hospital to keep themselves, the staff and patients safe. For the HTP Nightly News, Kendell Richmond.